Hello, and welcome to the Voyage Clinics podcast. I'm Dr. John Sanders, family physician and owner and operator of Voyage Clinics. I wanted to, as always, just introduce our podcast. Our objective is to bring affordable, beautiful healthcare to our communities. And today we have a very awesome topic to talk about, one of my favorite topics, mental wellness. We're going to talk a little bit about neuroplasticity and the importance of that in our lives. And we're going to talk about ketamine, some of the breakthroughs in the research in that space, and some of the utilities of that medicine in our lives, and to help people achieve higher levels of emotional wellness in their lives. So, yeah, no further ado. Welcome, Dr. Nyberg. You and I are good friends. We've gone way back for a long time.
Yeah.
And I really want to just take a minute to let you introduce yourself.
Thank you.
Give us a little bit about your background, and then we'll move from there.
Thank you so much, John and Dr. Sanders. Your audience, thank you for having me. I'm a psychiatrist. I was trained in rural areas of East Tennessee and then went to Ohio for my residency program. And I've been living in southern Utah and then have also traversed Phoenix and the Utah County in my search to find a way to save psychiatry and help people to have the experience with it that it was intended to have. It's really probably an uphill battle, but when we focus on the overall health of the individual and we're not talking about the psyche, or we're not talking about the emotional, the spiritual, the mental, we're missing a really big aspect of health.
Wow.
So I really appreciate you having me on, and I really appreciate and respect your dedication to treating the whole person.
I think we resonate in that space because you're on a mission to kind of save your profession, and I'm on a mission to kind of save my profession too.
We both want a doctor.
We just want to love and take care of people.
You do.
It's like new concept.
Right.
But I want to know, like, what is it that you see that's broken in psychiatry, and what steps are you taking to kind of fix that?
Yeah, and it's not particularly just psychiatry, but I think the medical model and the way that medicine and people have become commoditized is definitely having its downsides become more and more apparent. So, for example, if you interview someone about their leg injury, but you do nothing to engage with them, if most of the time spent is in your computer and just answering kinds of yes or no questions about them, they will pretty much start to close up and not share their story with you. I think it was Osler, one of the pioneers of modern American medicine, who said, if you listen carefully to the patient, they will tell you exactly what's going on. So it's not just true that we've lost kind of that sense of the heart and soul of doing practice for various reasons, but we've also lost a very key diagnostic tool, the indicator that when you drop what you're doing as a doctor and you listen to your patient, you have 2 ears, just one mouth. They tell you things that you wouldn't have heard otherwise. In fact, their whole story changes, and then they provide things that will change the trajectory of their treatment, usually for the better, more efficient, cost-saving, and less unnecessary stuff. Really kind of also cutting to the heart of the matter. I know you're concerned about your leg, but what underlies that? One of my great mentors in medical school was an internal medicine doctor, and he said, if I could go back, I would probably do psychiatry, because so much of what comes in my office, yes, it is presenting with medical symptoms, but there's this underlying kind of aching of the heart. And he was like, the more I am able to help them with that, the more we actually get down to the business of shaping up their physical health. It just rarely works the other way.
Yeah.
Would you agree?
100%.
Yeah.
In fact, we get so left-brained in medicine. Like we think that it's just science, right? But there's such a biopsychosocial component to every illness, every injury, every part of someone's healthcare journey, that we sometimes neglect that art side of healthcare, the listening, the intuition. I can't tell you how many times I'm speaking to someone and there's something there, and I just ask a couple more questions. I can sense it. I don't know what that is, but I ask a few more questions, and sure enough, we found something that's actually the root of the problem.
Really important, not really, a sideshow.
Right. In a recent conversation I had, I want you to recap this. You mentioned the magic that happens when in-person visits occur, as opposed to the telehealth and the video chats and things that are very popular.
Yeah.
Not that those are bad or anything, but like there is some nuance that's lost in that space. And can you speak to that briefly?
Oh, of course. And as a society and as a whole, we are kind of grappling with the difference in what we do when we communicate in direct face-to-face person. We're far more civil. We're far more attuned to the subtleties of body language, and we feel things that we wouldn't have felt before. It's hard to explain, but under certain imaging guidance, the brain is not lighting up quite the same way. They are not equivalent. Therefore, I am just cautious a little bit about, I want to make sure that we don't lose touch human to human. In all the amazing things we do to communicate, we shouldn't fail to reach out and touch one another, because anything less than that isn't actually what our ancestors for thousands of years have considered communication. It's something else.
Wow. So you're saying the brain lights up differently in person as opposed to in video?
For sure.
But is that on the doctor side, on the client side, or both?
For both.
Yeah.
Yeah.
Huh.
The reciprocality of it is different, and I think it's like a rocket scientist explanation for a well-known truth.
Yeah.
Things are just better when you get them in person. The quality of the care is better. People want high touch, high care services, and they don't know where to find them. They certainly can't get them out of the traditional medical models, which is why I admire direct care and other services that cater directly to, let's get the patient and the doctor back in the driver's seat, talking to one another.
Totally.
Yeah.
That resonates with me and my core values in Voyage Clinics. What
Very
we're
much.
trying to accomplish, more connection, more relationship, longer duration, and it's just beautiful.
Right.
Beautiful. That's
And
really
people
fun.
value it.
Yeah. That's really cool.
Sometimes the difficulty in my career has just been finding out how to be the person I am in the field that I am. And in advancing that space, the sense of overall holistically approaching the person and not necessarily operating a widget factory, you won't be surprised, but I'm finding myself drifting away from mainstream medical management. It's just not going to be that way.
You bet.
I don't blame those who need to use it. I mean, you do what you can with what you can. But as people either advance in age or come to appreciate the difference in the outcomes and quality of the care they are receiving, they're comparing to something more like, it's not a choice between not having care at all and having care. It's a choice between valuing care a little more and prioritizing it. Just as we have to value ourselves and provide self-care, which I know we'll talk about too, because we're talking about overall wellness and not just checking things off our boxes.
Yeah. Let's step back just 50,000 foot view for a minute. This is so good. I love it. Mental wellness in general, I'm a family doc, but I grew up in a small town, little mining community. The mental wellness and intelligence of that community could be, pretty dismal at times, but also beautiful. And I don't know, it's always piqued an interest in me. I play a lot of sports, and all growing up, my coaches would say, this sport is 80% mental. And if you look at the game of life as, it's a game, it's a sport. We're winning, we're striving, we're working hard, we're failing, we're wrestling or whatever. I think it's really important to have our mental ducks in a row. I've worked personally in this space. I remember during residency, I had a PhD psychologist who was a member of our staff, and I loved talking with her and just learning new things and understanding things. And I thought, wow, why isn't this stuff just taught to everybody? Like these are really important emotional intelligence tools that I feel like we should all be armed with in our relationships, in our journeys of life, and our failings. And so anyway, I just have always valued emotional intelligence and mental health in general as a part of people's holistic wellness.
Well, that is a perspective that I think resonates with me, and to the extent that I've only really worked with the people who are at their wit's end and their hardest day and their worst kind of situation. I think I've drifted into something more of a paradoxical encouragement where I say, our goal isn't to make you feel good, it's just to stop being miserable. And honestly, that is a balm to people, because when you encounter life as life occurs, whether the viewers have had this now or they're going to, it throws a few things at you that make you question the concept of wellness in regards to like, what about this feels well to me? In other words, if I'm in pain or I've lost a loved one or I'm suffering, reality kind of presents itself for questioning of what do you make of this? And what I find may be driving some of the dearth of difficulty in our own lives and in the lives of our young people, and perhaps the contributor, is that there's been a difficulty to establish meaning in the face of that adversity that is still in line with our other values. We've had traditionally meaning come from sources of spirituality, but the hunger for meaning is deeper than a church or a religion. It's about, as a person, what I'm going through and what that means to me, which is actually more in our driver's seat. And we have this obligation, is not the right word, but probably the necessity to define our meaning in some way. Otherwise, it seems to define itself for us as invariably painful, disappointing experiences. And wellness in the face of those things is not going to mean always feeling good about them. It's going to mean something more along the lines of finding your deep resilience, finding what you're made of, and nurturing the good and the beauty despite where you find yourself. I loved Viktor Frankl's book, Man's Search for Meaning. And he knew how to find that little silver lining in a place that was dark. Now, it wasn't just for the sake of doing it. It was for survival, because those who couldn't find meaning or couldn't establish a reason to press on, they perished. And that his experience was about concentration camps. I think if he can give us a guidebook to how to survive a concentration camp, then, we can survive certain things that we go through as well, and maybe even flourish in them, because the meaning of the joyful life, the life fully experienced, is certainly not to have these things taken off of our path. Right. And what makes a muscle stronger is just the same thing as what makes a person stronger. It's the resistance against something that would oppose, and the growth of something that could become more. So with that, I wonder if, talking about these different treatments and talking about neuroplasticity, we have an opportunity to shape the conversation in the broader sense of what does it mean to be flourishing and growing and becoming what you are supposed to become in your life. Your whole life, right? Body and spirit don't know the difference from one another. I'm going to tell you right now. And thus, nurturing them as one is a very promising way to get your results. It's not going to be from a pill, but sometimes pills are necessary. Now, I tend to advocate for treatments that can go around the pills. In fact, I think that the new thing about the ketamine treatments is it's actually enabling us to get away from the pills. Despite what might be touted about ketamine or whatever you've heard, you really haven't heard the whole story, because this is helping people get off substances, get off medicines, move forward in their therapy in stuck places.
We're going to go there in just a minute. I'm going to pin that spot, but
do it.
That is so good. Wow. Thank you for that. That was wonderful. I'm going to rewatch this podcast so I can listen to what you just said.
I'm going to rewatch it so I can listen to your soothing voice.
That was really good. I want to just talk about a couple things that you mentioned in there. One is, I think you would really love a poem my wife just wrote called In the Striving. It's beautiful. And it speaks to almost exactly what you just eloquently put into prose in a poetry way. And she's a great poet, actually. So anyway, I'll share that with you later. Just a side note. But I wanted to talk a little bit about, like, as a family doc, I see lots of health and wellness and sickness and diseases and all kinds of things. And I would say, again, just like sports, 70-80% of these things have a mental component to them, right? There's a stuckism, right? Like, I'm stuck in this way of thinking.
Right.
It's affecting me mentally, and it is affecting my sleep. It is affecting my mood. It is affecting these kinds of things. And so people get stuck in a oh my gosh, what if thought process that creates a lot of anxiety. And they're constantly thinking, oh my gosh, what if this? Oh my gosh, what if that? And they're stuck in that. People get stuck in it. Oh, coulda, shoulda, wouldas. And I wish I could have maybe, and then they get stuck in like that kind of thinking in the past stuff. So future stuff, past stuff, creating kind of a depressive feel. And they can't sleep. They're stuck in that. People get stuck in self-talk dialogues. I'm ugly, I'm fat, I'm stupid. I can't this, I can't that. And again, they're stuck, right? Mentally stuck, and it's affecting them physically.
Right.
They can't, their relationship with food is poor. Their relationship with exercise is poor. Their relationship with their body is poor. And so I'm excited to speak about this in lieu of the word you just used, neuroplasticity. And I want you to speak to that. What is neuroplasticity to you and to us as people in our life's journey?
Okay, great. Well, the more basic way to define it is your own brain's ability to stay open to experiences. Much like you learn to ride a bike, there are things you learn to do in life simply by doing them. And if you don't do them, you don't grow in that way, but you have a capacity to. And even as you age, you're not a dog that's learned every trick. There's things that your brain could learn to do that it has not done. Now, is it easier when you're young? Yes. But there's nothing really that you can't learn and master with repetition and with practice and immersion.
So it's an ability to learn new things.
Yeah.
Is it an ability to change our thinking and our minds around maybe we're stuck in a dogma, we're stuck in a paradigm?
You make a very good point. It's not only the ability to pave new pathways, but to clear out old ones that are not as useful. I like to make an analogy about the Winter Games when they came to Salt Lake City. So a lot more people flooded into the area. And in preparation for that, a lot more highway and infrastructure was put in. But long after the people had left the Winter Games, we had all that new infrastructure. And so it promoted a lot of the same kind of growth and development, even after it had occurred. Likewise, very powerful emotional experiences can catalyze changes that not only form new networks and form new pathways and connections, but help us break out of the mold. And perhaps without a Winter Games experience, you don't have a kind of a leap forward in development for the brain city that you're populating. Sometimes the furrows have become too deep. The horse and wagon rows have dug in too much, and no one can get anything done because they're only able to ride in pathways that are well formed. Neuroplasticity involves a kind of a breaking down and kind of smoothing over of the old ruts in the road so that your wagon can go a different way, and maybe you can upgrade it from a wagon. It's like the idea that you could have a chance, like a fighting chance, to actually explore new opportunities. Thus the interest that has come about in how do we promote that? Because it seems to me that people having new experiences is far more important for their healing and growth than having new information.
I love it. An ability to change what someone believes about oneself and the world is really pivotal to emotional development and intellectual development and emotional wellness. Like if you're willing to have that mental pliability to I used to think that way and it was unhealthy for me, and I recognized that and I changed it. That takes a lot of like awareness.
Yes.
and not everyone has that awareness. But really cool. And we're going to talk about how ketamine can help us with that neuroplasticity when we are having a stuck moment mentally or emotionally, and how we can kind of have lasting neuroplastic changes with ketamine, which is amazing. But I want to speak briefly to the holistic approach to that, which is what things can we do in our day-to-day lives that can promote neuroplasticity?
That's a great one. I'll start with two just to open this up. The first
Besides
is
pickleball, because pickleball clearly
of course
is the
it's
answer.
pickleball. Well, I love that you play pickleball, and we're destined to have some good matches. But as it happens, 30 minutes of cardiovascular exercise 3 times a week
Let's go.
is awesome for neuroplasticity. What it does is it actually helps promote the release of brain-derived neurotrophic factor, BDNF, which there will be a test later, but BDNF is kind of like a fertilizer for your brain. And it actually restores and even helps regrow certain cells like the hippocampal cells, which are memory cells. So there's a connection to staving off Alzheimer's disease and other memory brain problems from just 3 times a week of 30 minutes a day exercise.
Okay, guys, you heard it. You heard it. Dr. Nyberg.
We're all on the pickleball train now.
Let's go, pickleball.
And what you do when you release that brain-derived neurotrophic factor is you also combat cortisol. The buildup of cortisol because of chronic stress and chronic oxidative stress, inflammation, and so forth is actually one of the reasons you can't lose weight. It's why you feel tired, and it's why you burn out. So getting that in your life, one way or another, whether you feel like it or not, and there are tricks to that, start smaller than 30 minutes, but just, have a target and work your way up to that. Number 2 is actually writing down something that you're grateful for. This is not a cliche. I could go on ad nauseum. This is not a journal, okay? If you want to write a journal, then go ahead and write one, but I'm not talking about a journal. I am talking about the equivalent of a brain muscle movement that you're going to perform once a week, twice a week. Just start somewhere. Write down one thing that happened today you were grateful for or would like to see continue. That's it. Most people are right-hand dominated. Some are left-hand dominant. But the left side of the brain is the area that shuts down and loses motivation, becomes apathetic when we're depressed. And if you use the right hand and you start activating the left side, because this is all crisscrossed in the brain, you are priming the pump. You are basically showing your brain the movement that you want it to learn. And if you repeat that over several weeks, by 6 to 8 weeks, you have the same outcomes as you would if you were put on a medicine. Fact. It is no worse, and medicines are no better.
Whoa.
Yeah.
So wait. Let me just make sure that I'm good. So are you saying the act of writing something down can help with that?
It objectively helps because on day 1, if you wrote up in the corner of that notebook, I feel like my mood is a 1 out of 10 or 2 out of 10. And then you periodically checked in on that. By week 8, your mood improvement would be as good as any antidepressant medicine you had been put on. And they've never shown to be better than that.
Is that just the act of writing, or is it specifically writing something you're grateful for?
It's specifically the act of handwriting, not typing.
Right.
And gratitude, because gratitude is one of those things that goes by the wayside really quick when we're discouraged. See, I guess in nature, when you're down and out and you've had too many hits, there's no room for gratitude. Like you have to be thinking, well, the next thing that comes around is going to hit me and it's going to knock me over, right? But in that state of mind, every nail to a hammer, everything looks like a nail. So I tend to view everything coming into my life through the prism of what's this going to do to hurt me? And I miss out on opportunity after opportunity, and especially the things that would get me out of the rut. The very things that would get me out of the rut. I'm like, no, I can't. I'm too overwhelmed right now.
Yeah.
So whatever you can do to coax this part of the brain back into the movement that it's feeling like, no thanks, is good. Therapy helps that. Walks with friends outside help that.
Pickleball.
But it's not because of the exercise. And that's number 3. Being in nature, walking and having your eyes kind of move about the scenery mimics the movement that we try to produce in a therapy called EMDR, eye movement desensitization reprocessing. So I'm getting a little wonky here.
No. Pause. Because this is awesome. I want to hear what that does for people.
Right.
What does that eye movement
in the practice of EMDR, patients are helped to retrain their brain patterns by moving their eyes left and right to follow the therapist's cue. It's usually a sound cue or something visual, alternating that movement while they tell some story of something difficult. The therapist's job is to change the pace and tempo of those cues to match the emotion. It is basically kind of a therapy version of neurofeedback because it's giving you bilateral alternating stimulation to tell yourself what you're feeling. We need that apparently. Like from the time we're infants, we need to look up into our parents' eyes. And when we are sad, we need to see them going, oh, you're really sad. And everybody just does this like instinctively around babies. It's so funny. We exaggerate what their facial expressions are. Yeah. Why? Because brains don't grow on their own outside of birth. They actually require participation in a relationship. And we don't lose that need as we get older. But sometimes, it's like, I got this thing I can't unload. But you start talking to your friend and your eyes are moving back and forth as you go down the forest trail. And as you're talking and doing that, the left side of your brain and the right side of your brain are playing tag. They're playing pickleball with each other.
I was going to say it's
the
just
net.
like pickleball.
Because integration, of right and left brain is pretty much what we do when we treat trauma therapy. It's what we do when we resolve the past, because a lot of times we're stuck because we haven't actually told ourselves a story about what happened. We may have facts and we've got a lot of gut-wrenching feelings, but we don't have a narrative.
Right.
And the narratives we do have are outdated, not useful, probably keeping us in a rut. But how do you change your narrative without new experiences? And so all of these things are good. They're just grist for the mill.
I have to just briefly interject. I love mushroom foraging.
Yeah.
It's like one of my things. And part of it is the forest bathing or Japanese Shinrin-yoku thing where I'm just immersed in the smell and the colors and the sounds of nature, and I just love it. But while I'm foraging, I'm looking from side to side to side, and I can't tell you how good I feel after coming down off a mountain. I'm just calm. I'm at peace. And there's this meditative zone. I sometimes write poetry up there because I never write poetry. I'm not that great a poet, but something is magical there. And it's really cool to hear you eloquently kind of say, well, there's actual science behind me, like looking side to side in nature. Like that's super cool.
In our modern day, and especially in our professional lives, we probably overuse certain parts of our brain and underuse others. And being able to tap into something like that, whether it's creative or sensory, whether it's exercise or whether it's just connection, but it's all about driving this fusion of ourselves. The many selves that we are can become one coherent self. That's, to me, the definition of wellness is wholeness.
We've moved from neuroplasticity skills to a more holistic discussion, which is beautiful. It's true. I want to take it back just a second. So we talked about two cool things that can help us with neuroplasticity: cardiovascular exercise 3 times plus a week. And then the second one,
a little gratitude,
just a little gratitude, handwritten journal. Beautiful. I understand maybe even like trying something new and different, guitar lessons, dance lessons, something that pushes you and makes you try to do something that's kind of hard for you. Also creates some neuroplasticity. Is that somewhat accurate as well?
Yeah, I don't know if I can speak as much to that, but I think that for the purposes of treating an illness or an ailment, I would stick to basics. And then once you're better, the return of interest in those things will signal that you're out of the woods.
Oh, that's fair.
Right.
Yeah.
And then for those who are more like, I'm not in a rut, I just want to move out, I want to challenge myself.
Yeah.
Oh yeah.
That's the space.
Totally.
Yeah. And that's where I come from.
Which is where most people are.
Most of my folks are pretty healthy. They're pretty awesome. And I'm like, hey, what about bachata lessons? Let's go do some dancing.
Yeah, it's definitely good for you.
Cool.
And getting out of your zone is kind of to be made a fool in another zone. And that's okay. Like I'm the expert in one field, and then I move over here and I'm the novice mushroom gatherer who's green, because I took the wrong thing. But I'm expanding myself,
Okay, let's move into, speaking of experts. I consider you an expert in the ketamine space.
Thank you.
I'd like to just move into that, and I'd like to understand, how does ketamine work for us? Give us a little background on your ketamine expertise, and then let's move into the way that it works.
Okay, sure. So in private practice in southern Utah and rural areas, there wasn't a lot of room for any in-between treatments. Either you were getting medications, meeting several times a week with a therapist, several times a month with a therapist, or you were having to drive 3 hours up to be in the hospital. Or now they had a hospital there too, but it's a small town. Eventually, there's kind of only limited options for people who are in more serious trouble. It's not going to suffice just to see the doctor next month. And yet maybe they don't need to be in the hospital. And so out of my own private practice, there developed a natural desire to see what we could do for them that would help. And so I took an interest in ketamine because ketamine was an up and coming treatment for those who were in crisis, suicidal thoughts, people that maybe even perhaps even were in manic states or having psychosis, all these kinds of really serious problems. And it was having an amazing effect on about half of them immediately. So to have any psychiatric tool that worked immediately, it's kind of I love the journal that we were talking about, but it's better, at least for right at the moment. It does not fix what you have to do later, but it can forestall a disaster. So I started doing ketamine out of a small office in Iron County. I was next door to a pain clinic, and I was trying to see what I could do to, integrate with them. At that time, nobody was doing ketamine unless you had a whole surgical suite with all kinds of anesthesia set up. Mm-hmm. Everyone was scared to death of it. What they should have been more scared to death of is that we had a suicide crisis on the rise. Deaths of despair were going through the roof. And then that was before COVID. Mm-hmm. So from where we sit now,
it's worse now.
Oh my gosh. Yeah. The latest statistics on deaths of despair and suicide in 2022 are tracking with, or actually worse than the Great Depression days. Mm. We have never seen rates like this ever.
Let's nerd out about that later, but yes. I really want to understand what
the point is. When you find yourself losing to an enemy that's that vicious, you should not be as hesitant to try new methods.
Sure.
Whatever we're doing in psychiatry, as good as it is, we actually haven't changed or moved the bar whatsoever, the suicide state, risks. Mm. So here was ketamine that was showing promise to actually reduce suicidal risk. I took it up and started doing it. Then I was discovered by a growing company out of Arizona that was expanding into Utah, and they were doing a lot of ketamine, and they were also doing TMS, which is a different story. But transcranial magnetic stimulation, and ketamine were kind of these pillars of treatment, not as usual, but let's get something else going. Let's not just use a medicine all the time. I've tried 3 or 4 medicines. I need something to help me get out of this. So for 3 years up in Utah County, I was doing ketamine and have integrated into my practice these skills of they're interventional psychiatry, but they're a lot more than that. For example, ketamine has found its way into treatment that is not just for emergencies. It actually spans a lot more of the stuck places that we get into that are still ruining our lives, but are not necessarily sending us to the hospital. I could point to addictive behaviors, obsessive compulsive behaviors, depression and anxiety just to start. But especially in newer research, ketamine and other associated psychedelic medications like MDMA are finding therapeutic uses for treatment of complex trauma and trauma disorders that have, historically been difficult to root out, difficult to help with. The ketamine space is one in which the concept of what ketamine is already misunderstood very badly in popular media. Everyone thinks about, isn't that a drug of abuse from the 70s? Yeah, but what was it before that? It's always been a very safe surgical medicine or anesthesia, if you want to call it that. It's technically something like an amnestic, which means that you don't really remember much. But in doses 3 or 4 or 5 times what we're giving people for treatment now, psychiatry just discovered that ketamine could help at super low dose, like less than usually effective doses for other procedures. And you have to understand that people in the 70s wanted to use it at way higher doses than standard procedures. Almost everything you hear about ketamine negative is when people are using way more of it than is indicated. And I find that if you give ketamine in a controlled environment, safely with the oversight of nurses, doctors, and skilled professionals for reasons, you get really good outcomes. The mood disorders get better. The addictive disorders get better. So contrary to what might be the concern about, is this a new addictive medicine everyone's going to get into? Well, if they use it irresponsibly, sure. But you could say that of table salt.
Yeah. The ketamine dosing, like you said, now in the clinical setting is often a fraction of what's used in anesthesia.
Right.
And that, so to speak, anesthesia state, the mm-hmm. K-hole or that state, is that necessary when you're seeking treatment for getting people the neuroplastic changes that we're looking for?
Yeah, I think it's worth pointing out that the K-hole is kind of like a very, very severe, extreme, rarely happens unless you're really trying to have that happen and pushing doses much higher than the person's used to. But what if you start out by just kind of informing people that the experience of ketamine when done gently and when done at a nice low dose can be a very calming, relaxing, soothing experience. And I really like especially the treatment with IVs because they are, easy to control the doses and rate. You can turn it off if you don't feel good. The idea that it's like an all or nothing between extremes of a K-hole or not using ketamine at all is just absolutely, it's one of those things we do when it's something new and we just think, that's dangerous. It's like, no, our suicide epidemic's dangerous and these mental health problems are dangerous. And this is actually very mild. In fact, did you know ketamine is actually the amnestic of choice, really even the anesthesia of choice for kids.
Yep.
And it's always been valuable for helping kids because it wears off quickly.
That's what we used it for in residency.
Sure.
Always ketamine.
And weren't you always taught that it doesn't suppress people's breathing?
Mm-hmm. Yep.
Heck, you can give it over the top of other medicines that would otherwise be dangerous to give anesthesia with. And lo and behold, about half the people that take it feel significantly better from depression and other kinds of problems within the next day. It's just an accidental finding. But why? And that's kind of a natural question.
Mechanism of action for neuroplasticity, is it that it increases the brain-derived neurotrophic factor?
Well, there are a couple pathways, and BDNF is involved. So we talked about exercise, and sometimes you're like so depressed you can't even go out. Well, the ketamine is like an infusion of BDNF, certainly. But there's other kinds of complex pathways in which it opens up the potential of your brain to have a different outcome. Like, for example, by activating certain kinds of transcription factors. So getting wonky with the biochemistry, your DNA starts opening up areas of the library, so to speak, that have been closed off and gathering cobwebs. Oh yeah, we've got that back there. Let's get that book out, right? We'll wheel that old ladder down the hall and we'll go climb up on the shelf and pull that out and says, how to have fun. Okay, yeah, we're going to get that one and we're going to open it. And so the changes can be within a few days, but sometimes up to a week or two, where your brain is actually starting to direct different kinds of cell messengers to the surface and change the balance between some key amino acids and neurotransmitters like serotonin, dopamine, GABA for sure, which was always the object of the antidepressant medicines to begin with.
Right.
We now know, and it's extremely outdated to say that antidepressants like Prozac and Zoloft help people because they change serotonin levels. That's just so outdated. Like that's 30 years ago outdated. I'm sorry, but it is. It's more like saying if you cause a disruption to the serotonin system, the rebound response will be better for you, which is what ketamine does too, which ultimately—
But it does it faster.
Oh, way faster.
Yeah,
it takes a shortcut, right? Because the way that the serotonin does it is through a series of messengers that come from the outside of the cell and then take their time to track to the cell. But the ketamine activates these direct messengers that pass straight through to the nucleus and say, let's try something different here. And it's not like you don't do this in other circumstances. It's just that those tend to be more emotionally riveting circumstances. Like I have an experience that's very intense for me. And after that, I feel way better, but I don't know why. And this is actually the secret to why some of those older therapies that we don't really rely on anymore worked so well, is because they kind of shocked people out of it. But here, there's no shock. It's just like, wow, I feel way different. And that difference can persist because it's easier to maintain a good habit than to start one.
So the effects of it can really kind of hit and work and then kind of taper off after a week. Is there my understanding is like there's some research out there that shows a protocol that tends to create that lasting neuroplastic change. Do you find that the 2 doses once a week or 2 doses a week for the 3 weeks, or is it just 6 doses or 8 doses? I mean, is there that the research was on, 0.5 mg per kg, 2 doses a week for 3 weeks?
Sure.
Creates that. Have you noticed that there are other regimens that maybe once a week for 6 weeks is equally as effective?
No, that's a good point. So if you were trying to get back into exercising and someone posed the question of which is better for you, if you eventually get back into exercising, is it better that you started once a week or twice a week? And so the end goal actually is, what may be lost here is that the right treatment is the one that gets you there. And the ones that have been studied and shown to help have found no difference between 2 treatments for 3 weeks or 3 treatments for 2 weeks. They both tend, this around 6 clustered together, plus or minus, tends to give people a good boost that can last for a month or two. A month maybe for just one single ketamine treatment is all you could ask for. And people often ask, well, why would I do a treatment that's temporary and it's going to go away? And I tell them exactly this, because there's nothing temporary about getting unstuck. Nothing.
That's beautiful. So they couple it with some emotional intelligence work, some therapy, they mushroom foraging, pickleball.
Honestly, if they do all that, then they're just really show offs. They're just locking it all in. But they will do that naturally, whereas now it feels out of reach. And that's the point. It's
that's
like
cool.
A lot of what you would be doing to feel better, or a lot of what you would be doing if you felt better, you're not able to right now. And we're just trying to bridge the gap to your best self, normal self even.
I want to partially leverage this time with you to just educate my clients and myself on this. And I really appreciate your expertise here.
Thank you, John.
Just love this. This is so good.
It's fun.
Are there side effects to this that you would warn against? Like, what can I expect going in?
Right.
I want to talk to like the importance of preparation to pre-ketamine treatment. So let's speak to that, and then maybe we can go into maybe some of the side effects that they can, be aware of, and maybe some things where maybe I'm not a good candidate for ketamine.
Sure.
So let's start with the pre-ketamine preparation.
And then if you ever go online and you look at YouTube videos of someone's first ketamine experience, like you can see a walkthrough. And I think one thing that we probably don't nearly prepare people enough for is that this has psychological side effects and physical side effects. What are the psychological side effects? Well, the primary one is a feeling of being somewhat dissociated, or to put it more directly, feeling off. You feel weird during a ketamine experience, and that's not the purpose. In fact, that's more of the push before we get a good response. And so we're provoking your brain's system to be a little bit off. During the experience, you may feel calm, you may feel detached, but sometimes the detachment feels too much. When I personally went and did a ketamine treatment, which was wonderful and helped me so much, I was sitting in a chair and started to feel as though my body was somewhere 20 feet behind me. Weirdest thing, right? Other sensations may be different during the experience, but the primary one that we're trying to make people aware of is, experiences may vary. And you may find that it helps you, but it was difficult to go through. I'll give you an example in the medical realm. If your shoulder pops out of joint, guess what? It may hurt, but you need it popped back into place. So there are people that go and do a ketamine treatment and they say, that was actually pretty scary. I didn't like how I felt, but at any given time, asking them, do you want to stop? They would say no. And here's why. Because when they started to free associate during that experience, when they started to think about things they'd been through or associate them that, other times in their life, it's not like visions come out of everywhere, although that can happen if you're taking too much. It's more like they start reflecting on stuff. And, they may go back to some memories that weren't very pleasant. They may remember times in their life when they felt so alone and so helpless. Many will cry. And I will come in and say, what's going on? And there's like, well, I'm just kind of reliving this thing in my mind. And the strangest thing that I've always found about this is that they don't want to stop the treatment because it's almost like doing something for them that they need. The difference primarily being that they don't feel like it's happening to them again. They feel like they're seeing it happen. And from this kind of detached third place, they are looking down on what happened in their mind's eye from a safe vantage point, which actually is very therapeutic because that's part of what helps us start to form narratives. It's like, we can't do that when we're in our body and in our fight or flight system. But these are disturbing things. So that's one example of many where it's like, you could have experiences or feelings or that you go back later and go, that wasn't fun for me. And that's partly what we're saying is that may be necessary to move forward.
I want my clients to have a good experience with this treatment. And so we spend a fair amount of time just doing pre-ketamine preparation and explaining to them some of those things. And I think it's helpful to hear kind of your in-depth discussion there, just so it's not as disorienting, because it can certainly be very disorienting. It can also unlock parts of their emotions that they have maybe put way back there. And that can be sometimes scary and frightening, like you said, where they're reliving some of their trauma or some of their difficult things. You also mentioned some of the indications of it, the suicidality, when I've personally leveraged it for some of my clients in those spaces where, they're safe right now, but they're maybe a day or two away from having me take them to the ER,
Exactly.
right? And it just helps them get above, feel safe. One of my clients I just met with today, she said, within 3 hours, I was okay.
Yeah.
And that's huge, when before that she was not sure she was okay.
Yeah.
And so that's really huge. PTSD can be one of the indications. Severe depression, where they've tried a bunch of things and they're still kind of there. I find not even severe depression, but the depression that's like, and maybe depression is not the right word because you've taught me a little bit on this, but where they're just still
Brain
smoldering.
dysfunction.
They're just still smoldering.
Yeah.
And they're not really truly out of it. And,
Right.
And they're stuck in that space, right. And sometimes unlocking some of that with the ketamine treatment, the neuroplasticity helps them kind of get the therapy, do the work that they need to really heal those spaces. Really cool.
Yeah. I'm going to take a cue from what you said about different kinds of depression, because there is a kind of brain difficulty that doesn't mean you feel bad. It's more like you suddenly out of nowhere feel hateful to yourself, loathing yourself, like very actively wanting to harm yourself or hurt yourself. And this can happen in a variety of conditions. That sort of, I'm okay when I'm at the doctor's office, but a couple times a week I drop into that, really responds well to ketamine. And in animal models, they find that it turns off the center that's associated with shame and negativity, which has somehow or other kind of transformed from a motivational center to one of whip the horse while it's down. So anytime that people's head is beating them up while they're trying to move forward is a good opportunity for ketamine. And then especially in crisis or in suicidal thoughts, it's like at that point, any concern about the relative balance of risk versus benefit is completely obscured by, well, it's obviously going to help because you already feel that way. And that's where in PTSD, like the trick is that if you're in chronic low-grade PTSD, a ketamine experience can be a little rough for you. But if you're in a flare-up that's already been started because you encountered something this week that absolutely threw you off, the ketamine will just shut it right off.
Oh, that's really cool.
It's beautiful.
That's a good pearl. When should we maybe pump the brakes? When should someone say, oh, maybe I'm not a great candidate for ketamine, or maybe I should pursue other things before I do ketamine? Yeah.
Well, just like a medicine, there are people out there who have responded in pretty extreme ways to certain medications. I don't mind considering ketamine, but there are people who tell me stories about, I tried this and that medicine and I had all these extreme reactions. I think what usually clues me in a lot to that is if they were having something like a paradoxic reaction. For example, they took lithium and instead of feeling calm, they felt out of their mind, crawling up the walls all night. I'm like, that's not what's supposed to happen.
That's the opposite of what you expect.
Yeah, but not necessarily with antidepressants. For example, the SSRIs like Zoloft and Prozac can occasionally produce a reaction that is activating, especially Prozac Effexor, which is an SNRI. I don't necessarily take that to the bank, but mood stabilizers causing extreme reactions, I'm a little careful about.
Because they could have a hyper reaction because of the GABA stimulation here.
Yeah, and this has a lot more to do with the workings of the receptor that ketamine targets, because I have to know that inside and out, right? So the NMDA receptor is the target of ketamine, and lithium tends to coax that into some quiet. So if it's doing the opposite, I worry. If it's a medicine like gabapentin that's supposed to kind of keep things quiet and it's kind of throwing up a big cloud of dust, I worry about that. But in a more broad sense, I ask people what their goals are for treatment. And there is a balance of consideration between those who say, Doc, I don't care what it takes. I don't care what I have to do. I got to have this feeling stop. Well, all my reservations about ketamine just about went through the window because that person should and does deserve a trial, a treatment. But someone who's been already kind of once burned, twice shy when it comes to medicine reactions, and they want intervention, but they want the least potentially invasive, minimal intervention. I just think ketamine's not quite for you yet. You might need to try a couple other things. Let's talk about what you've done and let's see what those areas are that are non-medication usually that you might explore before ketamine. That way we're not getting into this high risk, high reward territory with you.
Mm-hmm.
And, the immediacy of benefit is certainly there. But what's the plan after the first or second session? These things cost something. And I think the financial considerations also will lend me more towards a medicine approach versus a ketamine approach. I mean, let's face it, if money was no object and you were going to feel great in a month regardless, do you want to be on a medicine in a month or have a couple sessions and you're good? Because I can tell you the ketamine works very quickly, maybe not always the first or second session, but by the third, I can see this is going to work. And sometimes I even call off the fifth and sixth. Now, if you got nothing to lose, if you're circling death's drain, do the sixth session for heaven's sake. But I guess I'm just saying that at some point it clicks and it helps. So the consideration not to use it would be, we can't afford to keep going down that road. We've only got enough to just try it once, and that's not really fair.
Mm-hmm.
That could even be kind of limiting in some ways. Like you get the worst of the parts of the ketamine and you don't get to see the good outcomes after 2 or 3 sessions. A lot of people with anxiety, ketamine tends to smooth it out the more they do. And the first session is more of the trouble spot where we're watching for rebound effects.
Brian, thank you. I think this is a good time to just pause for a moment and just explain that you and I are both clinicians, and we tend to throw around clinical things pretty quickly and easily. And this is really not intended to be clinical information or utilized in any clinical setting. You need to work with your doctor to get your diagnoses, your regimens all dialed in. But we're throwing this around because we do it so much, and we deal with folks and stuff like that. So I really appreciate your clinical pearls. Those are really, really cool. Side effects to this. Sometimes people get nauseous. Sometimes they get that dissociative side effect.
Mm-hmm.
And then they have this net enhancement to openness and to those kinds of things for up to a week or longer.
Mm-hmm.
Are there other negative things that are long lasting? How long is it in your system if it's IV? What's the half-life? Are we out of that pretty quickly?
Oh, heavens, yes. Not only is it out of your system completely within about 6 hours, it also is effectively not doing anything within an hour because it wears off so fast. The active ingredient is metabolized so fast. Your body basically processes it to something else that will eventually leave your system later that day. But the question that you're asking is still of merit. You can't drive for 5 to 6 hours afterwards. That's not a good idea. You should be careful about, doing anything different than your normal routine when it comes to other medicines, certain precautions about starting new medicines right before, just right ahead of, or right after ketamine. So I'll give you an example. When I first came to Utah, before I had started, not to Utah, when I first came to Utah County, and I was starting at a practice, I got a call from someone who had a ketamine infusion earlier that week, and they had 3 or 4 days of just really difficult insomnia. And what they were trying to do to address the insomnia was probably well-intended, but was not helping it. It was probably making it worse.
Mm-hmm.
So for example, certain medicines for sleep are actually not a good idea in the wake of ketamine because they're very serotonin-like. So trazodone being an example. So what they didn't understand, what they needed to understand was that ketamine is an activating treatment after the initial relatively brief sedation. And so for a couple of days, there may be restless sleep, lighter sleep, maybe even some night sweats or vivid dreams. And for those who are actually, who have an actual bipolar disorder, and they're getting treated with ketamine, it really helps bipolar depression, but you have to be aware of the flip, the potential for mania. Occasionally people also benefit from ketamine so much the first day that it leaves behind in its wake a rebound 2 or 3 days later, where you were just plucked out of hell and dropped into heaven for a little bit, and now you're back, which actually feels worse than when you started. So if there isn't kind of this understanding of, like, let's say, for example, I have relentlessly shaming, negative, self-harming thoughts, and I think ketamine is going to be great for this person, there's no way I'm scheduling them for just one, because to do that and walk away means I know they're going to get great relief, and then they have to put that back on again. And sometimes they're at higher risk then, which isn't talked about very much. But doing these things as a series tends to mitigate that.
And those people might be better with twice a week if they're waning that quick. We have a protocol where we call them a day after to check for any of the mania stuff. Good and then practice. 72 hours after to check for any tapering off, any of that kind of.
That's very responsible. I think there's not enough of that. And in general, the field is a little bit rife with discrepant modes of practice. They're really like what you're doing is a model of how you make sure people are taken care of. It's not just about informing them. It's about following up to see how it's actually affecting them, because experiences vary.
I think rife with discrepant modes of practice is a kind way of saying
no one's decided what we should be doing.
There's a lot of bad ketamine shops out there. I've seen a whole bunch of them, and it's frustrating. And that's one of the reasons why we brought it in-house, because we want to do it ethically and fiscally viably and all these things. It's part of our mission. Are there activities after ketamine treatment that folks should be doing to lock it in, to really leverage this ketamine? I want it to work as best as it possibly can.
Sure. Yeah. And if we take as a jumping off point what we had said about some moderate exercise and some writing down things, you could do a lot worse than setting your wake up time for a consistent time every day. Almost more than anything else, the circadian rhythm depends on our wake up. And I don't care when you go to sleep. Your body will take care of itself, but you must have a consistent wake up time, because what you've done with the ketamine is you've kind of given yourself a head start on reestablishing the right circadian rhythm, which has way more to do with your mood than you realize. And if you want to squander it by like having all kinds of random times you wake up all week, that's kind of on you. But you could take that opportunity to kind of just get your body to start cycling properly. And that way your sleep is more depth and more restful, and your days are more energized and productive.
That's really cool. So have a set sleep-wake cycle.
Just your morning wake up.
Yeah. Okay.
Because this is where we get overthinking of it. And it's like, no, you can stay up any night and do what you want. You can do all that revenge procrastination that we do. But come whatever time it is, it's actually more important that it's the same time than that it's early. You don't need it to be early. Just set one time and hold yourself to it. This may be one of the first times you've set your goals and actually seen yourself achieving them. Good, because you got to start somewhere.
Cool. Are there other things that we could be doing with ketamine to complement it, to really to help it shift us around and create some of those changes?
Yeah, I think you can notice that being with people doesn't require as much effort, and go with that. Don't assume that you're going to cloister up. Be just kind of open to experiences. And you might find that by not actively resisting, you passively go along. Like, for example, a family member or friend might be able to coax you out of your room. You will think, I don't want to, but you might notice something's giving way and allowing you to go with that wasn't there before. Good. Don't convince yourself that it's not working just because you don't feel different. We use this word feel like that's the most important thing. The feeling's the last thing that changes. So this is a pearl too. When ketamine's going to start helping people, the very first people who understand and know this are not the patient. They're the family members around them who see something about their physical activity, their sleep schedule, or their willingness to be in a group, not isolated, is changing. And they are excited. And they come in, they're excited. And then the patient's like, yeah, I don't see anything. And it's like, no, you are going to see something. They're right, but it's 2 or 3 more sessions from now. And then it comes over them, and pay more attention to the fact that you did pick up your guitar for the first time in a year and play it than whether you enjoyed it or not. Look, you didn't do it. You haven't done it for years. So that can kind of synergize with the gratitude. Is like intentionally noticing things. It's there for the seeing.
I love it. We strongly recommend our clients to be engaged in a therapy or have a therapist that they see.
I guess that should have gone without saying. But,
right. And I think it did, but that's okay. But it bears saying that therapy is crucial, and the changes that can happen with the breakthroughs that they can happen. My question, I guess, one of my clients just mentioned to me today again. She said, I did ketamine, I went to my therapist, and it was super unproductive for both of us. I was spinning, and
I hear this all the time.
I was cycling, and I was in a spiral, she said, and she could not. Nothing really helped in that therapy. The day after, she went to therapy again, and she said it was a totally different experience.
I was seeing in color.
yeah. And
totally.
And that was so beautiful. She mentioned that there was such a disconnect in her frontal cortex thinky brain. She knew what she was doing with her emotions. She could see it. And she was like, no, this isn't real. It's not logical. It's not reasonable.
Right.
But she still couldn't pull out of that. She was just so emotionally down there that frontal cortex couldn't like pull her up.
Yeah.
And so it was just fascinating. I think it's beautiful to have that release, that immediate saturation of going from zero to therapeutic with a medicine immediately, with immediate relief, 2 or 3 hours later being okay, and then having such a successful therapy session after and the week after. And it's beautiful. It's really cool to see the changes there. So therapy, I think, is one of the key components and the breakthroughs. Is there special like ketamine therapists out there, or should we just at least give the therapist they're working with a heads up? Hey, we're going to be doing ketamine, and you might have some more success with your therapy thereafter.
Yeah, I'll dovetail what you said by saying I don't think I've ever recommended ketamine to someone that I hadn't at least first tried therapy with. And so as a given, therapy has been tried by many who are doing ketamine. And as you pointed out, some of them it really hasn't been cognitive for them. The stuck point has been something else. Ketamine loosening that up and enabling them to go back to the same very valid treatments that are saying the right things, and then being able to practice them for the first time as though they had a new body is great. Mostly, I just recommend you stick with the therapist you've got. And for those who have taken a pause to therapy after the ketamine, it's very productive to go back to that therapist. And even if you don't think that particular therapist was for you, going back to treatment within the first couple weeks or month after ketamine is highly productive. We know that people get more done. That's a factual thing with the studies that we have. Therapy is maximized. Change, you're in a place where you can enact change. You can face things better. Ketamine during therapy is certainly out there. It's just not all that, it's not necessarily rigorously studied and systematized. And I have misgivings about where we are right now, just ultimately as even understanding the indications for ketamine, let alone doing therapy during ketamine. Now, there are a few professionals, but only a handful by name, that I would say you should go to them because they will integrate ketamine experiences, usually by you being either having a prescriber there or some arrangement they've got where you are actually under the influence of ketamine. But everything we're talking about today about its benefit is not require you to have a therapist with you during the ketamine treatment. In fact, I tend to just encourage people not to have any influence at all. There's no assignment. There's no direction. You come open to whatever it is that you're there to experience. Bring a warm blanket, bring something fuzzy, bring some comfort items. And if you bring a family member, that's fine, for your safety and comfort, but just minimize the kind of like chatter. Mm-hmm. This is a time to like see what your own heart is going to present to you, free of much suggestion. So really skilled therapists already do that. And they know how to use ketamine to further advantage. In my view, it's kind of this area with high potential for negative and positive experiences. In some ways, you're far more open during a ketamine session than you ever will be. But on the other hand, this is kind of why Freud eventually abandoned some of the hypnosis stuff, because it was like, well, I can access their unconscious, but I don't know if I'm necessarily helping them solve problems. It remains to be seen. So perhaps for the time being, and especially just kind of given the dearth of those who understand how to use ketamine safely and effectively as it is, let alone let's combine it with therapy and, suggest something to you while you're having a ketamine experience. I think maybe the best thing we can do is get back with a therapist or get into therapy in the weeks that are immediately after the ketamine.
Yeah, for sure.
Mm-hmm.
Dr. Nyberg, I want to thank you for your time tonight. This has been super great,
Yeah, it's
super
been great.
fun. And thank you for the wealth of knowledge that you've pursued in this. Thank you for your courage to pursue it and sharing your pearls with us, our clinical pearls. I love it. And yeah, just thank you for your contribution to healthcare in our communities. You've been a boon to our clients at the Voyage Clinics, and really grateful for you. And yeah, thank you so much. And with no further ado, I guess this is the end of our ketamine podcast. Thank you for tuning in, and like and subscribe to our channels. I appreciate you.
Thank you.